I think really Gary has been a leader among leaders in healthcare. The work that we've been doing for quality and safety and our improvement work, he has really challenged others in the industry to step up to do the same sorts of things, and I think that's had a lasting impact on healthcare in this country and in the world, quite frankly, with the work that we're doing through our Virginia Mason Institute around the world.
Gary is very committed to his vision, our vision of transforming healthcare. And that is that the patient becomes the focal point. It's at top of our strategy pyramid. And that's not just talk. Because Gary is a practicing physician as well as the CEO of Virginia Mason, he clearly understands what's happening at the patient level as well as the broader level. So he's committed to improving the quality, the safety, the well-being of our patients who are our customers, and that everything we do is focused on that and trying to provide greater value, that is, higher quality at a lower cost.
And he for years has reminded us that we've designed our healthcare systems around us, meaning the physicians, the nurses, the leaders, and that we need to change that and design them to be focused on the patient and the family members. And I think, again, his experiences as a practicing clinician really have brought forward some really innovative, revolutionary ideas about how we can do that, and frankly, very inspiring. I think that's one of the things in healthcare that's important, is for people who work in healthcare and for patients and families to have hope that we can make it better.
Well, I assume what we've done enables us to claim that he's a change agent. And it's hard to change American medical care because all the incentives are being applied in a way that would reinforce payment for care that may or may not be of good quality and may or may not be according to evidence. And we took a different path. That paradoxical path, I think, makes him a change agent. And it took courage, even daring, to do that.
Well, this is really a richly deserved award for Gary for one obvious reason and one not so obvious reason. The obvious reason is that his leadership in bringing quality care and new ways of providing health care to people has been not just helpful to our community or the state, but really to the country. People have looked for ideas on how to bring new efficiencies to healthcare. This is extremely important. We know we've got to reduce the cost of healthcare and provide more access. The non-obvious thing that I'm appreciative of is that Gary has shown our state how to embrace lean management principles, how to embrace the same high quality measures and techniques that Virginia Mason have used, Boeing have used, to increase value and efficiency. And we have used this in the state of Washington. So Gary's work has been humanitarian, not just in the healthcare community, but in helping the state of Washington be more efficient. So thanks to Gary, he's a great guy and a friend, and he's done a heck of a lot for our state.
He is not only amazing at what he does, but he's one of the most approachable people and accessible people that I've seen at his level. He's not going to stand on ceremony. He's not going to try to sort of increase his position in any way, shape, or form. That's not his DNA. He is about effectiveness. He's about listening. He's about leadership. But he's also, just a super great person to go have dinner with and get to know and interact with just as a human being, along with his wonderful family.
He's got a wonderful true north, and he goes there all the time. He's a good, wonderful husband, wonderful father, wonderful grandfather, wonderful son, wonderful friend.
His warmth, certainly his intelligence, and his dedication to whatever he's doing. As a doctor, and then as an executive, and even as a public servant now and then, as in that capacity. He gives it all it needs, and he's right there. His time's the most precious thing he has, and he shares that with us and everybody else.
You've been lucky. Yeah.
Thanks, Gary, on behalf of this community, for everything you've given of yourself, of your institution, of your wonderful heart to make us a better place, to embody the values that we so care about in the Northwest. And congratulations on a fabulous award today.
You're not just a great associate, you're a wonderful doctor, and speaking both as an associate on the board with you and as the board chair, but also as having been a patient of yours. It's been a marvelous experience, and I look forward to years to come to continually working with you.
Gary, congratulations on this award. It's an international award, which I think is perfect for you because it really shows the impact that you've had internationally on healthcare.
Gary, I think you always know how much we love you and how proud we are of you.
Gary, thanks for your leadership, not just in healthcare, but helping our state provide better services to our citizens.
Congratulations for this honor, Gary. Have a good trip to DC. Get back, get to work.